Good morning in Philippines. Do all of us know our immune system? What is healthy immunity and how can functional medicine help? We are going to explore all these questions in our session with Dr. Rolando Balburias, MD. Dr. Rolando is board certified in internal medicine as well as in functional medicine with IFM. I am Amita from Nourish Doc, a platform for natural, holistic, and integrative therapies. I'd like to introduce all of you to Dr. Rolando, who joins us live from Manila, Philippines. Welcome, Dr. Rolando.
Thank you, Amita. Good evening to everyone there in San Francisco and in the US. Yes, today I'm going to talk to you about how you get to know your immune system. So to start, well, one thing that we know about this virus is that, yes, it's very infectious, but it's not equally fatal. So the regulation of one's immune system is very important because our immune system need not to be just strong. It also needs to be very intelligent. It needs to recognize when it should attack and when it should stop attacking, so that what happens to people who actually died from the coronavirus, their immune system went into sort of like an auto-inflammatory response. So today I will talk to you about the immune system. Is a healthy immunity something that we cannot modify? Is it something that those people who died from the coronavirus were really just have no luck? And but no, the answer there is no. Yes, we can modify, we can boost, we can strengthen our immune system. Our immune system may manifest differently in different lifespan and in different lifestyle, but as long as you know and you know what it needs, then you can make your immune system optimal. Or do you know if your immune system is vulnerable at this point in time, especially with this pandemic, or if your immune system is already compromised? So let's explore so that you can support your immune system in defending you. As I've said, these are the characteristic of a healthy immune system. It should be able to detect and defend you when an invader is able to enter our system. But more than that, it's also important for the immune system to be internally regulated, because if it lacks regulation, then that's what it leads to, either a chronic disease like autoimmune disease, or in this particular case, an infectious disease that led into manifesting with an auto-inflammatory effect or impact that causes multiple organ failure. At the same time, one of the job of our immune system is also to repair us. No? But when the immune system is threatened and it knows that there is a perceived danger, it will not go into a reparative or restorative mode, not unless it knows that the enemy has been taken care of already. At the same time, for the immune system to be able to repair and repair us and recover from any diseases, whether it be infectious or non-infectious diseases, you need to be able to provide all its necessary substrates like micronutrients and macronutrients in order to repair us. No? And also, a healthy immune system needs to have tolerance. It needs to know, because many things will enter our body, viruses, pollution, any type of pollutions or any type of toxins. But if our immune system knows what is really something that will create a danger to us, then sometimes it may just tolerate some substances. But if you're suffering from conditions like asthma, like allergic rhinitis, sinusitis, or recurring urinary tract infection, oftentimes these are the signs or conditions that your immune system lacks tolerance. Or in other words, if you lack those 4 characteristics of the immune system, then your immune system is in a dysregulated mode. No? Because we know that our immune system has 2 parts, the innate immune system and the adaptive immune system. The innate immune system is what is critical for this time during the pandemic, because if it's strong enough to take care of the coronavirus, you're going to become those people who manifest with mild symptoms, and yet after a few days they recover from the flu-like symptoms. Or maybe if indeed your innate immune system is really very strong, then you are those what we call asymptomatic carriers. No, but if your innate immune system is strong, you need not to activate the adaptive immune system, because once it gets into the adaptive activation of the adaptive immune system, this is where, as if our immune system have declared war against that invader. And the problem with this particular virus is that it has displayed some deceptive ability, no, to circumvent or bypass or to make the innate immune system respond late. Of course, any defender, just like our military, its timing is very crucial. So oftentimes, this is how and why this virus became a pandemic, right? So next slide, please. So our immune system, as mentioned, 70% of our immune system is in our gut, particularly behind the wall of the small intestines. But there are some outposts, just like any military army. There are some outposts wherein our immune system is also present. Like it's present in your nose, in your lungs, in your urinary tract, and the vaginal tract of the woman, and of course, it's also present on our skin. So our innate immune system is our first line of defense. As mentioned, if this immune system, if this first line responder of our immune system is strong, then at times we never know it. Our immune system is fighting off something without us causing any symptoms. That's why it's important for us to recognize and know whether your innate immune system is optimal, vulnerable, or already compromised. So let's find out. So next slide, please. So tip number one, as mentioned, get to know your immune system. If you are someone with all of these conditions, no, recurring allergies, recurring infections, or if you have chronic skin conditions like eczema, psoriasis, atopic dermatitis, or skin asthma, or how many times in a year do you catch colds? And when you catch a cold, does it last longer that to the point that you even have to really consult a doctor and you're given antibiotics? No, it doesn't resolve with just a few days of resting and a lot of fluids. So if you're that type of person, then most likely your immune system is compromised or you are in a vulnerable position. Then your immune system may require some support or some restorative interventions in order for it to become optimal again. So number two, next. Okay, of course, you need also to know your risk for having a poor or weak immune system. As I mentioned, a healthy immune system is described as DIRT, right? DIRT. D, it should be able to detect and defend you. No? That's why sometimes you see elderly individuals, because of the weakness of their immune system, oftentimes they already have pneumonia, but they never manifest with fever, right? So only until such time that they're noted to have a loss of appetite and they're weak and tired, and when the workup is done, let's say an x-ray will be done or a blood test will be done, that's the time that an infection will be established, because the immune system, especially for elderly patient, was not able to immediately detect and defend that particular person, hence immediately able to bypass the immune system on the nose, on the throat, and then immediately affecting the lungs. But knowing your risk for immune system means that many of these things that you're doing on a day-to-day basis, now from your stress level to the quality of the food that you're eating, and to the so many medications that you are taking because you have chronic diseases or chronic lifestyle-related diseases, these are also your risks for your immune system, despite not having any acute symptoms or conditions affecting you right now. But this could also be reflective that your immune system may not manifest the DIRT characteristics. So next slide. Okay. So find out, no? So are you one of this? No, does this particular statements describe you? Why is it more common in males? Well, of course, as far as the data pertaining to chronic and lifestyle-related diseases like diabetes, hypertension, well, although in heart disease is almost equal already between females and males, no, as far as the worldwide data is concerned. But at the same time, males also at times their stress level, because they're the ones who are really responsible for the family, no? So the chronicity of the stress level may be so much that will also have an impact on their immune system. And oftentimes, they're also the ones that are really compromising the different determinants of health. Like they go, the way for they compensating for their stress is they smoke, right? Or they drink alcohol heavily, or oftentimes they really compromise everything from their sleep to their nutrition to the exercise. Hence, if you are someone like this, then we also know that your immune system likely during this pandemic is already vulnerable or already compromised. Hence, you can do something about it. Tip number 3, of course, if you want to enhance and boost and strengthen your immune system, let's utilize food. But of course, I'm talking here about whole, real, and unprocessed foods. No? Foods that can provide all the metabolic substrates that your immune system will need in order to perform its function of defending and repairing us. I'll mention some immune nutrient essentials later on at the end of my presentation. But of course, where do you get most of these substrates? Most of the substrates like micronutrients, like vitamins that are important for your immune system, like vitamin C, vitamin D, minerals like zinc, selenium. Where do you get most of this? Of course, from plant-based foods. No? So if you're going to try to get the necessary amount of substrates, micronutrients and macronutrients coming from processed food or ultra processed foods, well, you're not going to get it because many of them are already nutrient depleted to begin with. And at the same time, many of them may contain substances that will also become a challenge for your immune system and making your immune system more dysregulated. So next. And of course, the reason why we want to harness the power of plants or plant-based foods is because many of them contains phytonutrients. Phytonutrients are plant-based chemicals that are aligned with how our biological, biochemical, and physiological design of our body. Now, many of these phytonutrients can really provide the substrates, the cofactors, and or stimulate the enzymes or the neurotransmitters that will help our organs or the different biochemical processes happening in each every organs of our body. And not only that, many of these plant-based foods actually contain its therapeutic benefits as having an anti-inflammatory, antiviral, antibacterial, the same characteristics and properties that you find in your pharmaceutical interventions. No? So that's the value and importance. And these are just some of a few examples, especially pertaining to having an antiviral effect or having an anti-inflammatory effect or an immune modulating effect to our immune system. So number 5, let's go to the next slide. Of course, next, just to continue with the list, these are some of the cruciferous vegetables because, well, they contain a lot of, as I mentioned, micronutrients like vitamin C, vitamin D, vitamin K2, which are not only protective, in fact, to your immune system, but also protective to the other systems of our body. Remember, in functional medicine, we looked at the body from an adaptive biological network of systems wherein there are other systems like your transportation system wherein many of the products or micronutrients or phytochemicals or antioxidants present in many of these foods can actually protect those several systems as well, just like your blood vessel or the wall of your blood vessel, or it can protect and restore back the balance of your hormones. Or many of these plant-based sources of foods can actually help detoxify your body or remove toxins from your systems, which could also be contributing to why your immune system is dysregulated. So next. And sometimes it's also not important not just to look at the quality composition of the food that you're eating. Well, in Ayurvedic medicine, we know that functional medicine is sort of like the modern version of Ayurvedic medicine. It has been around even before modern medicine. So it also looks at the body from a systems perspective. That's why it's important also to recognize that the physiological and biological design of our body is hardwired to the ecological system, how the ecological system is designed. That's why it's also important to know the manner and the time of when you are eating, because our body knows when it is daytime. No, so we have a biological clock in our brain. We call it the suprachiasmatic nucleus, wherein the body knows that it is daytime and the body knows that it is nighttime. And when the body knows that it is nighttime, some of the physiological functions performed by the body is put on a halt, because during sleep is when we are able to regenerate and restore back the different systems of our body. So we know that by 9 o'clock, actually, the stomach stops functioning. So that's why we discourage you from eating late at night. We also encourage you to have at least a 4 hours gap between your last meal to your regular sleeping time. And of course, we also know the value and therapeutic benefit of fasting. For whatever reason you're using fasting, to some people, of course, for some because of their religious or spiritual practices. But we know by science, it's backed up that fasting is really therapeutic. No, it can cause what we call mitochondrial biogenesis, no, wherein your body is able to generate or create new and more efficient mitochondria. That's why it can translate and lead to more efficient energy metabolism. These are some of the few ways to implement a fasting state. But there's a disclaimer there. Of course, if you're suffering from many lifestyle chronic diseases and you're taking several medications as well, so it's important for you to consult first your doctor. It's good if you're able to consult a functional or an integrative medicine doctor or a naturopathic doctor, because they're more knowledgeable and trained about how to utilize fasting as part of your healing interventions. Next slide, please. So key takeaways, as I've said, spacing your meals to create a 12-hour fasting window between dinner and breakfast, or at least also the last meal for the day and your first meal the following day. There should be at least a 12 or more than 12 hours gap in between that. No, but if you're the type of person who's eating almost every hour or every 2 hours, and because you're hungry, you will tell the doctors that because I'm hungry, that's why I'm eating. Well, it's time to look at the quality or the nutrient density of the food that you're eating, because if the food that you're eating is really nutrient dense, you're not supposed to go hungry at least even after 4 hours or 6 hours. Okay, so well, one type of fasting, the fasting mimicking diet, these are the ones I recommend for those patients who are really having or struggles with eating issues. No, but that's one easy way that will make a big difference already on and providing some rest to your system. No, because our body, as I mentioned, is like a machine, right? So very important for us, as I've said, to provide rest to your system. Okay, next. Tip number 6, of course, not only food, not only the pattern of our sleep and the pattern of our eating, the composition of our food, but even sleep. As I mentioned, that's why there is a required amount of sleep. We're told that 8 hours of sleep, because as I mentioned, the way our body was designed, we're supposed to be asleep by 11 p.m. because by 2 a.m., which is supposed to be the deepest part of our sleep, this is the time that most of the organs or the organ systems of our body are regenerating, except for the liver and the skin. Okay, so because if we're able to achieve that particular depthness of sleep, then our body is able to produce all the metabolic substrates that it needs in order to protect us again for the following day. Substrates such as hormones or all the immune cells are produced between 12 midnight up to 6 a.m. Substrates that are needed for the health of your blood vessels are actually produced from 6 a.m. to 12 noon. No? So that's why it's very important for us to harness how our body or the biological design of our body by providing it some form of therapeutic sleep. No? So it's not true also that as you grow old, you require less and less sleep. That is not true. No? So even if you're 70 years old, you're supposed to at least be getting 7 to 8 hours of uninterrupted sleep. Of course, for children, it should be higher, between 10 to 12 hours, no? Because as I mentioned, this is how our different systems able to regenerate in order to protect us on a day-to-day basis. Okay, so next slide. Okay, of course, there's also a way for you to be able to stimulate and tap in or activate, no, how your immune system can manifest that particular characteristics of DIRT, having internal regulation, having the ability to repair and restore your body when you recover from diseases, and to have that particular tolerance. No? So, and this is where we get the benefit from having the appropriate exercise for you, because even with exercise, it needs to be personalized. That's why doctors in functional medicine, we are trained to provide exercise prescription. No, you're not just supposed to follow what your friends or your neighbors are doing, or if the trend is everyone is into high intensity interval exercise, you need to find out whether what type of exercise your body is suitable to have, no, so that it can help restore back the balance of the system, because there are different types: balance exercises, cardio exercises, resistance exercises, and not only the type of exercise, but also the timing and the frequency and the intensity of exercise. Because exercise done strenuously can actually damage the gut wall that protects the 70% of your immune system. That's why it's very important to customize and personalize as well the exercise regimen that you are doing based on what your system needs. Next. Okay, of course. So we're done with physical. Now let's go to mental. No, so stress is part of our life. No, mental stress, emotional stress, psychological stress, or even physiological stress emanating from our own body system. That's okay as long as we know that there are two types of stress: negative stress, positive stressors. But if it's just balance and not predominantly what we're going through is all negative stressors, but in this time of the pandemic, it's understandable. But it's important for us to know that stress can only be harmful to us if it becomes chronic. But if we're able to provide restorative and reparative activities for our body to put us in a relaxation response, or in order to activate the parasympathetic system, then stress will not cause much problem to our system, most especially to our immune system. But chronic stress will not only impact on your immune system, because chronic stress will dampen the production of the natural killer cells, the army of cells that our innate immune system utilizes in order to defend us immediately. But at the same time, chronic stress will impact on the quality and the quantity and the duration and depthness of your sleep. Because when your cortisol is persistently elevated even late at night, we know that cortisol follows a circadian pattern wherein by 10 p.m. it's almost supposedly at a zero level in our system. But if your cortisol level brought about by the chronicity of your stress is persistently elevated, that will definitely impact your sleep. No, you might even suffer from a sleep wake cycle dysfunction. Okay, so that's why it's important for us to be able to better manage our stress levels, no, and recognize the balance between a positive and a negative stressors. Next slide, please. Okay, yeah, that's what I'm saying. The key is to finding the balance. No, so we need some short-term positive stress, but we must also protect ourselves from negative, long-term, or persistent stressors, especially if the stressors is not worth stressing about. Okay, so talking about the immune system, as I mentioned a while ago, if you want better immune health, if you've recognized now that your immune system is not optimal, it is challenged, and it is actually vulnerable and compromised already, then you can begin by assessing and looking at your gut. No? So one thing that I can advise you is to look at the food that you're eating from the perspective of your immune system. Are you consuming very inflammatory foods comprising with processed foods, or you're able to consume different colorful variety of different macronutrients of whole, real, and unprocessed foods? So look at what you are feeding the 70% of your immune system. Because if you are feeding it with a lot of pro-inflammatory foods, then no surprise there why your immune system is going to be very dysregulated. Okay, next slide. Okay, so there, of course, as I mentioned, our gut um, um, is not just an organ for digestion. It's not just an organ for assimilation of nutrients. Our gut contains 70% of our immune system. Our gut is where the trillions of microorganisms, particularly bacteria and some viruses, archaea, protozoa, resides. No? And in fact, many of these bacteria are, which we call the microbiome, is very crucial and critical and fundamental and foundational for keeping the 70% of our immune system to be at its optimal state. So it's important for us to re-inoculate and replenish this microbiome, especially if you're damaging it on a daily basis because of the many maintenance medication that you're taking, because of the toxic foods that you're eating, because of the chronicity of the stress that you're having, or because of the sleep deprivation that you subject your body on a day-to-day basis. In that case, you'll know that your immune system or your gut health is very compromised. So how do you restore back? How do you restore, replenish your optimal gut health so that it will reflect an optimal immune system as well? So, you know, in IFM, we were trained to apply the 5R framework: remove, replace, re-inoculate, repair, and rebalance. No? So that's how we restore back the optimal gut health. So sometimes when your gut health or your small intestines are really damaged and leaky, and its ability to assimilate nutrients coming from the food that you're eating is really affected or very inefficient, this is where sometimes, next slide, I try to utilize nutraceuticals in order to restore back and provide the optimal substrates needed by your gut immune system or by your gut wall or by your gut health in order to repair it. No? Because the gut wall is a very thin layer. It's a single layer of cell that can easily get damaged by the things that we put inside our mouth. But it can easily be repaired by the immune system as long as the immune system is provided with the different substrates in order to repair it and to restore back its balance, particularly to modulate the immune system response of the 70% of our immune system in our gut. Next slide, please. So there. So these are some of the micronutrients and macronutrients. Like, of course, vitamin C is a very potent antioxidant in combination with zinc and selenium. Actually, they can actually have some protective way to prevent the virus from entering our system. Quercetin as well. No? So quercetin has a very potent immune modulating effect. No? And vitamin A and vitamin D, these are both required by the innate immune system of our body in order to produce the different army of cells that will help them manage the invaders so that we don't need to activate our second response or responder of our immune system, the adaptive immune system. So many of these nutraceuticals or nutrients coming from the food that you're eating would help, would be the difference between how you're going to be able to overcome when you get infected or you get tested with this coronavirus, and how you're going to be able to fight it off and it will just really manifest like a flu-like symptoms, or whether you're going to transition to that cytokine storm. So it's important for you to make sure, you know, there in the United States, all of these micronutrients, they can all be measured already. And as I mentioned, each of us require a unique amount of of these different metabolic substrates, because there is such a thing as what we call biochemical individuality. So it's important for you to know that you're able to provide how much does your system or your body system really needs, either coming from the food that you're eating, or with the help of some supplementations in order to provide the exact amount that your system needs. Because when it comes to our health, it's very important for us to remember that we cannot apply the one size fits all approach. No, when it comes to your diseases, yes, you can do that. But when it comes to your health, particularly to your immune health, no, each one of us requires a unique level of substrate. So we cannot apply the one size fits all approach. We need to apply the one size fits one approach. So if you know your immune system, ladies and gentlemen, then you'll be able to optimize or make your own body as your own PPEs, right? So if you can optimize your body system, particularly your immune system, then you need not to really be afraid. You just have to make sure you can make sure that your own body is your own PPE, or your own protective personal equipment, because your immune system can handle any viruses, can handle any bacteria. Okay, that's what differentiates the immune system from any vaccine, because every vaccine that is developed by man is designed only to take care of one organism, right? So that's why we have to be given so many vaccines. But there is one system in your body who's responsible to why, despite the fact that there's so many people who died from this coronavirus, there are also so many people who recovered from this coronavirus. That's why I do not want to just talk about the virus, the coronavirus. I really want to emphasize and give credit to our immune system, because the immune system is the one responsible why worldwide, no, more than 80%, or I think almost 90% of those people who got infected by the virus recovers or even able to fight off this particular coronavirus infection. Okay, so I think that's my last slide. So I hope you learned something, and I hope now you get to recognize where is the level, or what is the measure of health of your immune system. Are you having an optimal immune system, or do you have a vulnerable immune system, or you already have a compromised immune system? Thank you.
That's excellent. We are open for questions. I see people in Zoom. So if you want to ask questions from Dr. Rolando, you can put it in the chat window. This is excellent what you said. I just had one comment. You said that people who are taking medication, they might have a weak immune system. So let's say someone walks into your office who have been taking medication on, I don't know, diabetes or blood pressure. So how would you? I mean, you have to wean them off the medication. How would you start that process?
Well,
You know?
I never meddle with how the conventional doctors are managing them, but I orient and educate the patient that many of those medications that they are taking are actually in itself drug muggers. They will be depleted of the different nutrients that their system needs. In fact, many of the cardiovascular drugs that are given to patients who are manifesting with polypharmacy or into polypharmacy, they're depleted with zinc, they're depleted with specific antioxidants like ubiquinol or CoQ10, they're depleted with magnesium, they're depleted with with vitamin D. No? So oftentimes, I never definitely just meddle and discontinue and tell my patients to stop their maintenance medication. I first begin with that. And of course, especially if I see that their nutrition is really compromised and they're not able to provide all the specific micronutrients and macronutrients that their system needs, hence their hypertension is really uncontrolled, or they're manifesting with what we call resistant hypertension, because they're already on three kinds of medications, and yet their blood pressure remains to be uncontrolled, and yet the complications accompanying long-standing hypertension is still happening to them. And then that is most likely because they are severely micronutrient and macronutrient depleted. So that's where I first begin with their nutrition, no? And oftentimes, depending on the compliance of the patient, if the patient is really an active partner, and they're able to really implement the food plan that you give to them, you'll notice that, or the patients notices it themselves. No, I've had cases wherein the patients are the one personally discontinuing their medications, because they will tell me when they follow up that, but doctor, every time I take it, I notice my blood pressure is already below 100 over 70. It's because when you're able to provide the micronutrients that is important for a healthy blood vessel, then the reflection or the manifestation of an unhealthy blood vessel, which is an elevated blood pressure, the food now provides the synergistic effect, that is the same effect, how their drug was designed. And with that, when my patient comes back to me that way, I'll tell them, oh, please don't do that. Please go back to your cardiologist and tell him or show him your current weight, show him your blood pressure monitoring, and the doctors are the ones who's discontinuing their medications. That's how I do it in my practice.
Sure, sure. Any questions from people who are watching? You're welcome to ask questions. I'm just uh, clarifying a few things. Um, so the other thing is, like, let's say, what kind of test would you run on someone? Would you run like some kind of a blood test on, just to
Mhm.
see if their immune system is weak, or some kind of a stool test? I mean, the whole bunch of tests that you run, and that to see, if someone is.
Well, Amita, we are a third world country, so learning everything from IFM from the United States, I had to adjust and modify how I apply functional medicine in our country.
Sure.
My clients or my patients in here can be the super rich, no? So, but at the same time, I have patients who are ordinary, regular people that who cannot even afford to buy supplements, or definitely will not be able to afford the functional test that I do to my rich patients. So, but this is where the value of what I learned from IFM. We were given a toolkit. We're given a lot of questionnaires. We're in. That's how I do it, no. And in IFM, we were also trained to do a nutrition-focused physical examination. So that's how I do it as well, no, by looking at the nails of my patient, the tongue, the gums, the scalp, the skin. So if my patients have no financial capability to do the test that I require, then that's what I do. I utilize a lot of survey questionnaires provided to us by the institute, or I do a nutrition focused physical examination. And from there alone, I get to determine what are the micronutrients, vitamins or minerals, or macronutrients that this particular patient of mine is severely deficient. And that is how I personalize their food plan. No, that's how I collaborate with my nutritionist. And But if I have the opportunity to do the functional testing, which I send to most of the laboratory tests there in the United States. But right now, even those even if I want to right now, we're having problems with shipping there in your country. So specimens are getting rejected by the laboratory where I send it to there in the United States. So that's why I really have to adapt and adjust my practice. But that's the beauty of this particular approach. We're not limited by the lack of contact with the patient. We're not. I'm not limited by the lack of laboratory. So what I do is, do you know how I do my nutrition focused physical examination? My patients send me their close-up photos of their nails, of their
Oh,
gums, of their tongue. No, and from there I do my physical examination. So that's how I adapted my practice and translating completely into an online platform. So
sure,
I'm not
sure.
limited by the lack of tests, as long as the patient is willing to give information about his lifestyle, about what he goes through in his life, mentally, emotionally. I get to help patients the same way, as even if my patients, the same way as my patients when I'm interpreting laboratory test results of my patient. So it's a matter of when I have the diagnostic test, then I practice precision medicine. But when I don't have the diagnostic tests, for whatever reason, I practice personalized medicine. So
Sure.
that's what functional medicine is all about.
Great, great, great. Any questions before we wrap up?
Mhm.
You're ready to wrap up. So if there are no more questions, I just want to wait for a second. If I see people in Zoom, if there are any questions, you're welcome to ask in confidential. No problem. I've stopped sharing. So okay, if there are no more questions, you can send us an email if you can't think of any questions, and let us know later. With that, I'd like to wrap up this session. Thank you so much. I think it was very informational for all of us who are living in during these times to how to improve our immune system, and I think all of us can benefit from your session today. I want to thank you for coming. Any last comment from you before I wrap up?
Thank you for inviting me, and I hope we do not allow the infodemic that is happening as well together with this pandemic to really scare us and uh, to to limit what we can do. And of course, with all the information out there, it's important for you to be able to filter and to know whether those information is really accurate or those information is going to do good for your health as a whole, personally, because a lot of people are utilizing the power of information for a certain agenda. So let's all be careful, and let's try to be kind and to be considerate of each other. We are all in this together. Everyone is affected, maybe at different levels, but it's good if we're still able to maintain peace and love and harmony with each other. That will make it easy for us to overcome this pandemic.
Thank you.
Thank you.
And that's why we are doing a lot of educational sessions on a weekly basis. We are bringing
Mhm.
experts from all over the world. They're presenting evidence, they're presenting research, to help all of you with better health. With
Yep.
that, I'd like to wrap up this session. Thank you so much. Have a great evening. And
Yes.
please share our sessions if you like them. With
Yes.
that, thank
Thank you,
you.
Amita.
Bye-bye.
Thank you,